Good afternoon. My name is Frank Haney. I'm the Winnebago County Board Chairman, and I am joined by Rockford Mayor Tom McNamara and Dr. Sandra Martell, Public Health Administrator for Winnebago County. Thanks again for joining us today. The state reported about an hour ago 1,140 new COVID cases for a total of 25,733. The 25,000 plus compared to less than 100 on March 18th. I heard an interesting story lately about a hospital situation in the state where the doctors and nurses worked very hard with a patient that was struggling greatly, and through their efforts and the fight in the patient actually wound up going off a ventilator, out of ICU, and is making on a road to recovery. We've seen similar stories like that in social media throughout the country. When I heard that story, my mood changed. What's the rub? Is if we're going to have patients fighting and we're going to have frontline healthcare workers and first responders fighting, then the rest of us need to continue to be up for the fight as well. Today, I want to center my remarks around another group that is in a bit of a fight through this COVID epidemic or pandemic and all that it includes, and that is our small business owners in our community. Myself and many others have been very vocal proponents of residents staying at home and adhering to social distancing in March and April. It is clear these efforts have helped bend the curve, slow the spread of COVID-19, and I believe save lives. For that, thank you very much for your continued commitment. Social distancing, wearing masks, and washing our hands, it works. It's proven to work, and it will continue to work if we stay committed to it. It is science. The experts were right in this regard. We should continue to listen to their guidance as the governor's order comes to an end on April 30th, 2020. Unfortunately, early May is also a time when we are expected to hit our peak, unless something greatly changes, of COVID cases in Winnebago County. That's what folks are suggesting the modeling is telling us. It is important that we don't get a false sense of security because models are being adjusted down to reflect the success of our citizens' commitment to social distancing. We have learned this, is that the virus spreads quickly, it hits hard, and that a second wave will be larger than expected if we don't apply these principles going forward. As a layman, people always ask, when will this be over? The best answer I've heard is when there's a vaccine, which could be over 12, maybe even 18 months away. That's to be determined, but it's not anytime soon. This is not the beginning of the end of the COVID-19 response, but perhaps sometime in early to mid-May, it may be the end of the beginning of the response. A public health crisis by itself is extremely challenging, and this one may be one of the most challenging that we've ever seen. But a public health crisis coupled with an economic crisis is even much more difficult. To that end, there are more than 22 million Americans have become unemployed over the last 6 weeks. As we mentioned before, 513,000 Illinoisans filed unemployment between early March and April 5th. That being a 400% increase over that 5-week period that began the Great Recession. A recent study showed a large percentage of local or of small business owners are concerned to some degree about their survival over the next year and a half. I do not need to tell you how hard the hit has been in Winnebago County. You see it with your own eyes. You hear the stories with your own ears. The video of the Charles Street shoe shop owner and his mother talking about how hard it has been on their business and their family brought many of us to tears. Their story is the story of many small business owners in the Rockford region. Just as COVID-19 impacts our health in inconsistent ways, some more harshly than others, it has done the same on the financial side as well. To be clear, the governor was right to take decisive action around COVID-19 mitigation in mid-March. I believe it saved lives. Inaction would have cost lives, and we'd be in a much worse situation right now. However, it is also clear that I believe anyway, that there is a little bit of inequity between big box stores and small business in the order itself. And as we go forward and we work to perfect or adjust things as we go forward, not just in May, but in several months ahead of us, maybe we could take a look at that and adjust it to the realities of our current and new environment. It certainly could be reevaluated. Economic leaders like public health and healthcare leaders share their expert opinions in their respective areas of expertise. They all have solutions that are easier to implement when you do not have complicating factors such as the other. So for the public health folks, we're working on things through a tough economic time and vice versa. Unfortunately, we don't have the luxury given that this is a two-front war. And although we all agree that the biggest threat to the economy are major surges of COVID-19 cases, we need to adjust our strategy at some point in May or in the early part of the summer. Social distancing 2.0, for lack of a better term, would allow small business perhaps to reopen at some level that's responsible and still strictly adhere to social distancing principles that we know work. Unless things change greatly, it may not be responsible or prudent to just 100% restart all business May 1. And I know that is being talked about. It does not make sense from where I'm sitting. It has been said that the right balance may not be about flipping the switch on the economy as much as it's about adjusting the light dimmer where we phase in changes over time. And we balance the need to reopen our economy very closely tied and aligned with public health of our community. Social distancing is going to be a way of life, I believe, for the rest of 2020. The science of social distancing will work in a small business if we are vigilant and committed, and if we work with our healthcare professionals to make sure we do it right. And vigilance is key, because here's something we're also not talking about. Consumers will not return to normal shopping habits if they do not feel safe. So let's adjust our strategy where we can, continue to strictly adhere to the principles that we know that work with social distancing, and evaluate as we go and as we move forward together. Progress is the goal, even if it is not perfect. I have respectfully relayed my thoughts to the governor's office, as many other community leaders, including Mayor McNamara and other mayors as well, have done that. I do want to take this opportunity to thank the community for their commitment, and together again we will get through all of this and come out on the other side. And with that, I will turn things over, I believe, to Dr. Martell is next, and again want to thank her for her leadership. Thank you.
Good afternoon, and thank you, Chairman. Today, as we have 144 confirmed cases in Winnebago County, but no additional confirmed deaths. So our total number of deaths remains at 8. But I think part of the discussion I hear, and as I walk around the community, social distancing appropriate, as people send me emails, is, can you tell us more on the modeling? The modeling is becoming more difficult as time has gone on. And part of it is because now we have implementation of point-of-care or rapid testing. So we don't know how many tests are out there overall. We've talked about this before, the point-of-care testing, the rapid test. We get the result back immediately, but I don't know how many were done overall. So when we're looking at where the disease spread in the communities, it's very hard to model then at that point. To date, less than 1% of our population has been tested, so 0.7% if you were to look at that. If we estimate that 20% of the population could be carrying or become ill, only 3% of the estimated ill have been tested to date. So we clearly have a testing gap of understanding how this disease progresses. So you've heard a little bit about how do we model, what are our dates projecting out there, and partly we are dealing with that kind of model changing. We hear, is it flattening? Clearly, social distancing has had an impact, and we're happy to, be able to really reinforce that with our community. I know it's tough. Every single one of us, we all have our favorite thing. Personally, can't wait to get a haircut after this is all over. But I think every single one of us has much more important things that probably we want to make sure that we get to. But we really have got to make sure that we're below that 20%. And we're having some difficulties understanding how testing is going at this point. So we are working now. Our Emergency Operations Center the National Guard has come to work with us to establish a local drive-through testing under local leadership at the University of Illinois College of Medicine Health Sciences campus in Rockford. So you'll be hearing more about that in the coming weeks so we can expand testing. We want to remind our community that our healthcare providers continue to offer testing. Of course, they want you to call before you go in. And if your symptoms are mild, they may make a different determination about how best or when to bring you in. But it becomes important, again, if you feel that you need to be tested, please contact your health care provider either through telemedicine, telephone, before you go in. I think that the other part I want to kind of talk about is while we have ramped down on non-essential services, I want to remind the public that healthcare is an essential service. One of the things we want to hear from all of our healthcare providers is that we don't want you to lose control of your long-term healthcare conditions of a shorter-term pandemic, right? You may have diabetes for 5, 10, 20 years, and while we're going through this, it becomes important that you still manage and that your providers are there to take care of you. Nobody should be going without their medications refilled. If you need a check with your physician, most are offering telehealth visits, either through computer or telephone. Others are making special accommodations for appointments to come in for your evaluations and appointments. But we need the public to understand that healthcare is an essential component, right? Just as important as getting out for your groceries and your guests and anything else you need to do that's considered essential, healthcare is important. We don't want your chronic condition to worsen over this, because then we'll be battling on two fronts. So know that your healthcare providers, every single one of them, is available to manage your condition, and they are really wanting me to reach out so that you know that they are ready to care for you, even while they're caring for COVID-19 in the community. So again, I want to remind everyone, don't lose control over your long-term health care needs during this relatively short-term pandemic. I think this becomes important. You will be living a long time with those conditions as you have, and we don't want them to worsen over this time frame of the pandemic. Another kind of been a couple of things about one of the things that I've been asked to talk about is, while many of you are practicing your social distancing, and today the skies are blue, is that congregating in parking lots is also a situation. So as you go to a walking path or you're going to go and take a walk down that path, the parking lot is not the time to congregate and get together, because again, that kind of defeats the purpose of social distancing and ramping that down. The other part is essential service providers. We're encouraging you to remember to wear your masks. I've seen a lot of, and I want to give kudos out to several service providers for Winnebago County Health Department that have to do the essential service of maintenance, came in with their masks on, ready to go as reported. And so again, I see this happening every day, whether it's a mail carrier, whether it's a package delivery service, whether it's a food delivery, and we appreciate that because again, it protects the worker, and also this is a way that we can help for those essential workforce to diminish the spread in our community. So I want to come back and say, remember that we're continuing to test. We don't have as much testing as we would like out there. You heard the governor say they're aiming for 10,000 tests per day. We would like to see more of our population tested so that we have a better understanding. So as we really recover and revamp and come out of this, that we have a better way to manage and handle any other subsequent outbreaks. So these are all the tools that we have right now. So we appreciate it. So just a reminder, if you need a COVID test, your healthcare providers are able to do that. Call before you go. Do not let your long-term conditions wane during all of this time frame. Your healthcare providers want you to check in with them, and they are ready and able to provide you with the care that you need during this time frame. And the other part is when, even as the weather opens up, that, again, social distancing is our primary tool that we have right now. Frequent hand washing, social distancing, and frequent cleaning of services. So thank you. And Mayor McNamara, you are next up on the speaking points.
So thank you, Dr. Martell, and thank you, Chairman, for your leadership and partnership as we work through this pandemic. Each time we're here, we hear Dr. Martell provide us the numbers of the day. It's certainly a sobering reminder to all of us that there are individuals, family, and friends behind each one of those numbers. Just want to say my thoughts and prayers are with those families who have lost a loved one, and my thoughts and prayers are with all those people who are fighting valiantly against this really horrific disease. However, as you've heard me talk the last couple of times, we've talked about this idea of the day after COVID-19. There certainly will be a day when we get through this pandemic. And so I want citizens to know that we are planning and preparing for that day. Just this month, coming up Monday at City Council, we will be approving the first of many packages, construction packages, to get multi-million dollars worth of work out into our streets that will be affecting numerous wards all across our city, from the east side to the west side, so we can continue to improve our infrastructure. Also, more broadly, we will be developing a wide set of working groups to advise myself, city staff, and aldermen in how we plan to execute our recovery after COVID-19. These groups will develop ideas and recommendations for our team, the City Council, and the broader community to consider and act upon to help us build a stronger community than we were prior to COVID-19. I'll be speaking more about these working groups next week. Since the COVID-19 pandemic swept across and began affecting Illinois, we've been working closely in Rockford and Winnebago County for a unified response. We opened the countywide Emergency Operations Center, what you often now hear us call it as the EOC, back on March 12th. Beginning on March 18th, we began to have daily calls, daily COVID-19 policy group meetings to coordinate strategies and tactics on a countywide level. In these meetings, in these policy group meetings that we have every single day, you have myself, you have Chairman Haney, obviously Dr. Martell, our emergency operations representatives, our Rockford Police and Fire Chiefs, the CEOs of Swedish American and OSF St. Anthony, and the Chief Medical Officer of Mercy Health, and the CEO of Crusader Community Health, and the Dean of the University of Illinois College of Medicine right here in Rockford. We are also in regular communication with the governor's team as well as Illinois Department of Public Health. It's literally been a team effort in serving our entire community. And I believe that team effort and unified approach has served our community well. We now know both the extreme patient challenges we're facing, as well as the financial challenges brought about by COVID-19, especially on our health systems and our health providers. People are becoming extremely sick and even tragically dying. Our hospitals, which is kind of unique, are also, at the time that they're needed most and helping us most, are also hurting financially themselves, as they've had to put aside things like elective procedures to better serve COVID patients and prepare for a potential surge in patients. This has been exceptionally difficult for everyone, and especially our health systems. This week, I want citizens to know that our policy group began discussions about the three health systems working together to slowly reopen their facilities to elective procedures while still preparing for a potential surge in COVID-19 patients. It's us working on parallel tracks. A unified plan would provide better services to patients and ease confusion that could come about if one or more health systems was not willing to participate. Our public health administrator, Dr. Sandra Martell, who you hear from multiple times per week, has contacted the Illinois Department of Public Health in her role to begin discussions about the possibilities of such a unified plan. The Emergency Operations Center and our policy group is a most appropriate venue for developing policy and strategy related to the COVID-19 response. It's worked well for us thus far, and we believe it has worked well for the community when we all work together. However, this morning, Javon Bay announced in a news release a proposal to provide inpatient services at its at the Mercy North Rockton Avenue campus for all patients in the city needing COVID-19 related hospitalization. This was distributed to the media literally during our policy group call this morning. We are disappointed that Mercy Health CEO Javon Bay has chosen to act unilaterally without working through the proper channels, the Emergency Operations Center and the COVID-19 policy group. I've reached out to Javon during this crisis and have not heard back, nor has he chosen to participate in any of our policy group discussions. So I want to be clear. We are, as a community, far stronger when we work together. That has been a guiding statement through this crisis and will continue to help direct all of our community's response to this pandemic. It serves our residents well, and it serves our health responders well, and as well as our first responders well. While we're disappointed in Javon Bay's actions, we will not let this be a diversion or a distraction in the work we are doing and for our entire community. We are fortunate, and I got to underline that, we are fortunate to have 3 amazing health systems in our city with amazing employees. All of them have stepped up to treat COVID-19 patients and to prepare a collective strategy for a potential surge. We will continue to work collaboratively within our Emergency Operations Center and our policy group, and we will collectively vet the Mercy Health proposal thoroughly and determine what is best for our entire community and what is best for all of our healthcare providers. So I just want to close and say, as I often do during these, we will get through this tremendous challenge that we're facing today with COVID-19. I fully expect our city to be stronger and healthier because of a staid focus and how we've overcome this disease together. To get there, though, I must just close and say we must remain vigilant and we must remain together even though we're apart. So I'm asking you, please, stay home. Continue to practice social distancing. Continue to practice washing your hands and those surfaces frequently. Stay healthy, and please also stay hopeful. Thank you.